This video is going to discuss a single arch GuidedSMILE LITE case completed by Dr. James Hamill in Ireland. GuidedSMILE LITE is a variation of our GuidedSMILE product under the GuidedSMILE family of services. GuidedSMILE LITE was designed as a more competitively priced alternative to our metal GuidedSMILE Chrome, and it is a very effective product, especially if you have a lot of experience with stackable guides. Because this is plastic, it's a little more delicate, and so that you want to just follow the normal procedures, but with a little bit of a twist because you have a delicate plastic fixation base and a osteotomy guide that is also plastic. Now I say delicate, but really these materials are strong. We make surgical guides out of these materials every day, hundreds of them. But it's just a uh, little different mindset when you're not dealing with a metal fixation base and osteotomy guide, clearly. So this product is a little bit more affordable. Contact us about pricing. We can also make it more quickly, and we do enjoy having an option here for perhaps the mid-market or perhaps that particular patient who cannot afford the Porsche of the GuidedSMILE line of products. It was called GuidedSMILE LITE, LITE, and it's on the work authorization, and you can order it today. We've made hundreds. So let's go through this case. The records are normal for a light case. Left, right, center photos, full smile, full face. If needed, take some more smiling or exaggerated smile photos. A CBCT scan with the teeth apart as normal, and normal STL files, upper, lower, nice bite scan. We go through the normal process, meet you online, plan the case, ship you the guides, and of course a surgery mat. And so as you can see, LITE really has a lot of the same attributes as a standard GuidedSMILE case. So let's go through a surgery real quickly, as we're doing with this series of videos. The process is very similar to a GuidedSMILE Chrome case. So you'll try in the pin guide, make sure it fits, make sure it doesn't rock, and then you'll lay a labial flap apical to the fixation base. Now the fixation base on a light case is a little bit thicker, right? This is 4 millimeters instead of the typical 2 of metal. So it's kind of hard to see in these images, but you will need to lay a little bit taller. Well, here, this image here, you'll need to lay a more apically positioned flap so that you can seat the fixation base. That's really about the only difference with flapping. Now, the nice thing is, as you can see here, it is still floating guide technology, which is why we bulked up the fixation base, right? Because it's not nesting on bone like all the other systems on the market. This is part of the patented Chrome system that it's floating, and we do that for a lot of reasons. But one of them is easy installation beyond the undercut, floating over bone, not worrying about fitting it to a imperfect rendered bone segmentation. So as normal, tap in the pins, be a little more delicate with when you stop tapping because again, it's plastic. Seat the fixation base and then adjust the bone down to the level as normal. And of course, be careful with not to hit the burr on plastic, right? Don't want to get any resins in the open wound site. And of course, you don't want to injure the fixation base. The osteotomy guide, per request, we can put holes in here, little irrigation visualization holes. Just let us know. Otherwise, you're drilling as like a typical plastic guide. Hopefully, there's internal irrigation and not as much visualization, but you do get the job done, and it is a product that we have gone chairside to and delivered hundreds of times. So it's very effective. Carrier guide is seated. Multi-unit abutments are placed. And let me just go back here. We do have, of course, indexing for making sure the implants are rotated properly, right? Nubs or circles, just normal without nubs if they're straight. Multi-unit abutments go in. Gaskets go over the temp cylinders. Prosthesis is picked up as per normal. Plugs go in, backfill, right? Suture, convert, and Dr. Hamill completes these conversions in 12 to 15 minutes, very fast, and delivers. And something that Dr. Hamill has taught us is pick up the surgical prosthesis, pick up the rapid appliance per normal, but use the rapid appliance or the surgical prosthesis to go to final directly. No prototypes, no try-ins. Just make sure that the surgical appliance, the bite is good, the patient's happy with the smile, make some little modifications digitally, go to final. The reason I mention that, I don't normally mention that, but I mention that because this is supposed to be a more affordable process to go to final. And you can also use some alternative materials in your final restoration, which we can talk about. Give us a call. We're in development with some companies, and we have some products now that can be considered long-term temps or even finals to keep the overall cost of GuidedSMILE lower for some patients. And that is GuidedSMILE LITE.